Hello, everyone. My name is Morgan Little. I am a student at the Pennsylvania College of Health Sciences. I'm going to be doing a presentation on the self-instruction teaching method. I will start by explaining what self-instruction is. Self-instruction simply is an independent method in which the learner can guide themselves to reach the learning objectives at their own pace. Typically, self-learning modules are on the computer and they focus on a single topic where the learner can guide themselves through the module in order to learn a new topic or a new skill. This method can be effective when learning a skill which requires step-by-step instruction, and we will learn more about this a little later in the presentation, how this can be used effectively. There are several different types of domains of learning, including the cognitive, psychomotor, and affective domains of learning. Self-instruction focuses on two of these domains. So self-instruction focuses on both the cognitive and psychomotor domains of learning. The cognitive domain, also referred to as the thinking domain, it involves acquiring information, addressing the learner's intellectual abilities, their mental capacities, understanding, and their thinking processes. So self-instruction can be included in this type of teaching in this domain because it forces the learner to think about and read what they are learning and then reflect on what they are learning as well. Self-instruction can also be put into the category of the psychomotor domain or the skills domain because this domain involves acquiring fine and gross motor skills. Some examples of these skills include walking, handwriting, or performing a procedure. In the healthcare setting, if you apply it to this setting, it may include giving an injection to a patient or maybe drawing a medication into a syringe. These would be included as psychomotor skills, and self-instruction can be included in this type of teaching as well. There are several pros and cons to the self-instruction method, and we will go over some of those. Some pros or advantages to the self-instruction teaching method include that the method is inexpensive. It's fairly easy to implement in different types of settings. It is self-paced, meaning that the learner can go through at their own pace. If a learner likes to learn at a very fast or rapid pace, this method is good for them as they can go through at their fast pace. It's also good for those learners who maybe don't learn as quickly as others. They can also go through at a slower pace and focus more on what they need to learn. This method is an active learning, which means that the learner must be engaged throughout the module in order to learn. Modules also allow the learner to review and reflect on the information presented. So if you think about a learning module that you might have to do for work or for school, you can go back and forth to different slides and you can review the information presented. There's also feedback built in to the self-learning modules, which makes it easier to learn. So often learning modules have quizzes or questions at the end of the module to allow you to learn about what you just learned and to engage a little bit easier. A con or disadvantage to the self-instruction learning method is that this method is difficult for learners who are illiterate or can't read, or learners who have low literacy learners. So children might not benefit from this method as easily as adults. Also, adults with a low grade level reading level might not be able to benefit from the self-instruction method. This method is also not suitable for learners with visual or auditory impairments, as the learning modules often incorporate reading and listening into the modules. The method requires learners to be motivated and engaged, so it's not the best learning method for learners who procrastinate and tend to wait to the last minute to do their work. It's not good for them to learn this way. And also, the learner may become bored throughout the module, especially if it's long. They might not be engaged, so they might not be able to learn best from this method. Applying this information to healthcare education, self-instruction can be effective in patient teaching, also teaching students and teaching our peers as well. Patient teaching with the self-instruction method is easy to do. This method can be used to teach patients a variety of topics. So as healthcare professionals, we teach our patients on a daily basis. We teach them throughout their hospital stay, at discharge, and we can use self-instruction to teach them a variety of different things. One topic it can be used in is self-examination. So the book mentioned using teaching self-instruction through breast self-examination. So if a doctor or a nurse needs to teach a patient how to do a self-breast exam, they can use self-instruction to teach a little bit easier to the female patient. Also, teaching patients medication administration. Self-instruction can be used through this way as well. If you think about when you have to teach a patient to use an EpiPen or an insulin injection, or if you have to teach an asthmatic patient how to use their inhaler for the first time, self-instruction is a particularly effective method to teach them. One article that I found in the Journal of Asthma focused on teaching children to use an inhaler. It found that children who watched a video on how to use their inhaler were able to guide themselves a little bit easier and use their inhaler easier through the self-instruction method. Self-instruction can also be used in student and peer teaching. So if you have to teach nursing students or medical students or a coworker a new skill, the self-instruction teaching method can be easily used. One article that I found in a journal of trauma and emergency medicine found that self-instruction can be effective to teach CPR techniques. So I'm sure we've all done a CPR class that involved self-instruction, maybe a video or a self-learning module, and where you had to guide yourself through it. This study found that a 10-minute video was presented by the American Heart Association that taught untrained or lay people to use various CPR techniques, including ventilation techniques and also hands-only CPR techniques. It found that the self-instruction video was very beneficial to teaching people without any CPR training. So this is particularly effective in the community setting when we have to teach patients or students or peers new techniques or skills. And going back to that step-by-step instruction, it's particularly effective when teaching those new types of skills. In conclusion, the self-instruction teaching method is a beneficial method as it is cheap, it's cost-effective, and it also allows the learner to go at their own pace. It can be difficult sometimes to use this method to teach learners who are procrastinators, who are not motivated. They might not be able to engage themselves in this type of learning, but it's also good for learners who like to be engaged as well. It's a good method for them to use. Self-instruction can be used to teach patients, peers, and students in a variety of settings, and it's good to teach them a variety of new techniques or skills in different settings, including the healthcare setting. I listed my references here for you. I hope that you enjoyed my presentation and that you learned something new on the self-instruction teaching method. Thank you.